Okay, so today I'll be talking about Junctional Epidermolysis Bullosa, or JEB. I was interested in this disease because it primarily affects draft horses, and I worked at both a carriage company for a while as a driver, and then I worked at an Amish dairy farm this summer, and they use a lot of these horses for work and pulling carriages. So JEB is an incurable inherited disease, primarily with draft horses. It causes moderate to severe blistering of the epidermis and the mouth, and it affects newborn foals. So their hooves also slough off, and so that's why it's known as red foot disease. And you'll see pictures of that later. It'll make more sense. It develops at pressure points, so at the hooves, the joints, and the mouth. And it worsens with time, so it might start as moderate, and it might not look so bad, but very quickly gets worse. So it eventually leads to death within a few days, but usually euthanization happens before then, out of respect and care for the animal, and it affects up to 35% of all Belgian drafts. So there's two different mutations of this disease. The first one is JEB1, and this mutation occurs on the LAMC2 gene. This mutation affects both French and Belgian drafts. And then the second mutation is JEB2, and that occurs on the LAMA3 gene, and that affects American Saddlebred. And both of these breeds are primarily used with the Amish community. It's an autosomal recessive disease, and so it lacks the protein laminin 5, which causes the skin layers to not stick together. So because it's recessive, either both parents have to be a carrier of the disease for the foal to be affected, or if just one of the parents is a carrier, then the foal will also be a carrier. JEB is a very well-documented disease, so we know what gene is affected and what the mutation is. But as documented as it is, it's still incurable. There are tests for it, so if you're into draft horses and you're looking to breed yours, I feel it's important to get your horse tested just because a large percent of foals can be affected by it. So if your both the mare and the stud are carriers, you shouldn't breed them, obviously. So this would be an example of a foal with the red foot disease. You can see here how high up it's begun to spread, and all 4 of her hooves are affected. And then this is a great example of the sloughing off of the hooves. You can see that the hoof wall doesn't even connect to the padding of the foot anymore. So likely both of these foals would have been put down and euthanized before anything got worse. And then those would be my sources.
And there's your sources. Those are some good pictures, my gosh.
Mm-hmm.
So does it always show up early for like when it's double recessive?
It does. It shows up when they're born.
When they're
so
born.
They'll be born with it.
So then do most people euthanize right away?
They do,
Okay.
just because there's no cure, and
Right.
it will get worse over time.
Yeah.
So.
And that was a young foal, and that
It
was
was.
terrible the way it looked.